Hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, and I am super excited to have Brianne Boyd on our podcast today. She is an ultrasound technician and the owner of Rural Imaging Services, which she started about 6 months ago, which is a cash-based mobile ultrasound imaging service. She drives all over the Eastern Washington and does imaging at hospitals and locally for doctors' clinics. So we're going to learn about her background and the details of her setting up the business and how it can help you if you need an ultrasound to save money and to save time. Brianne, welcome to our show.
Hello, Shawn. Thank you for having me.
So tell us a little bit about your history.
With ultrasound?
Yeah,
or as a human?
in general. So where'd you grow up? And then,
Well, I grew
how'd you
up
into
in a
ultrasound?
small town in Eastern Washington called Omak. And if there are some of you out there not familiar with it, you can Google it because we have the world famous suicide race and it's pretty amazing.
The Omak Stampede, right?
Omak Stampede. Yep. So I grew up in rural Eastern Washington. Moved to Seattle for college, graduated with my bachelor's degree in diagnostic ultrasound, and then moved back to rural Eastern Washington. And now I live in Ephrata. Population about 8,000 people.
So you worked in some hospital work for a while as an ultrasound tech, or?
Yep. I spent the last 15 years working at Columbia Basin Hospital here in Ephrata. And I loved it there. Everybody was amazing. I love my patients. I love my coworkers. But I just needed to change and I needed something more. So
what made you decide to open your own rural imaging service?
Well, I got some inspiration from a doctor. He is a locum doctor that travels to all the small hospitals around. And he was in Othello and he came to me and he said, have you ever thought about taking ultrasound on the road? Because we could really use echo in Othello. And I just thought about it and I thought, I could really help a lot more people if I took ultrasound on the road. And here I am. 6 months later, I'm doing it.
Awesome. I love it. So tell us about what does that look like? Ultrasound on the road. What does that look like?
Well, I have my own machine. I have a brand new Canon Applio i700 and I have a van. And no, I do not scan in my van. People ask me that all the time. We drive, my husband and I, that's what, when I say we, that's who I'm talking about. We drive to hospitals or clinics. We unload the van, go into the room, scan patients, load the van up, and come home.
And what a great service that is. So tell us a little bit about give us an example of a case where you really saved. I don't want to cherry pick for you, but I guess what I'm asking is, so some people that you scan have probably a hard time getting out and around, correct?
Yes.
So when you come to the doctor's office, it saves them a lot of hassle having to go to another clinic or hospital to actually get a scan.
Oh, yes, for sure. So for instance, I'm starting in Odessa next Monday, and Odessa patients were having to wait months and drive all the way to Spokane to get an ultrasound. And now they can stay in their hometown and not have to drive. So in those instances, I feel like I'm helping out the rural communities.
Yeah. I mean, that is just you can't put a price on that.
Yeah.
I mean, that's going to save, Odessa to Spokane one way is, I think it's at least an hour and a half. So you're talking about, you're saving the people, probably a day, basically a day of going to Spokane, getting an ultrasound and coming back. That's an amazing service. So let's talk about pricing.
Okay, let's do it.
You don't bill any insurance directly, correct?
I do not.
Okay. And what is why do you not bill any insurance directly?
Well, what I have found is when you bill insurance directly, insurance dictates what you can charge. And what they charge is pretty insane. And I don't want to charge my patients that much. And so I don't. I
Well,
charge what I feel is a fair price. And the only way I can do that is by charging cash.
so we like to call that in free market medicine is that, it is, you're right. You charge a fair free market price. And what that does is it not only makes it less expensive, but it makes it better quality and it makes it better service. And how is that? It's because you are not dictated service, price, or quality by an insurance company. You're working directly for the client. So you want to give them the best service possible and the best value possible.
Yep.
Right.
So they're getting the same quality service. I mean, I worked at Ephrata, I've worked for Confluence, Samaritans, the same quality service from the same radiologists that read for these other hospitals and clinics at a very, very affordable price.
Yeah, with the same machine, you probably use the same or maybe even a newer machine
It's
than a
actually
lot
a
of those.
newer machine, yes.
Yeah, right,
Mhm.
right, right. Okay, so tell us some things about pricing. I mean, one of the things in healthcare when people say, "Oh man, it's not covered by insurance," man, this must be really expensive. So tell us how much an ultrasound costs with you.
Well, it depends on the ultrasound. Um, I do general ultrasound, OB ultrasound, vascular ultrasound, and echocardiograms. So all of those are on different cost levels. General ultrasounds are generally less expensive, and echocardiograms are the most expensive. So um, my costs are anywhere from $150 to $400, and that includes the cardiologist read fee or the radiologist read fee, which we call professional fees. Um, at a hospital, um, you're going to pay a 2 to 4 times that, and that's with your insurance. I mean, I don't know what your copay is
Right.
going to cover, but that's the charge. So,
Well, here's one of the things about those and about that and when you bill insurance is there's no transparency because you really don't know what the price is going to
correct.
be.
Yeah.
And here's the other thing too, is there's surprises.
Yeah.
So many times, and I'm sure you've heard it many, many times,
Hmm.
there's that, $4,000 imaging at the hospital that you think is going to be covered by your insurance. And then all of a sudden it's not. And, so you got $4,000 out of pocket.
Yes.
Or the patient says, well, I really want to bill my insurance. They come to you and you say, well, it's going to be $400 for this imaging. Well,
Hmm.
I want to bill my insurance. Okay. So they go through the hospital system, they bill their insurance, the insurance pays for it. And it ends up being a, $3,000 imaging. And then they've got to pay 20% of it. So they end up paying $600 out of their pocket and they waited 6 months to get prioritization and they could have just went to you and paid $400, right?
Well, I have a patient. To give you an example, I have a patient coming to my home office on Friday. She has not met her deductible. So she's coming to me and getting an echo for $400. If she would have had it done at a particular hospital, it would have been $1,600 because she hadn't met her deductible.
Right. Right.
So that's the reality of the situation.
Well, and here's the thing. This is what I love about what you're doing. This is also one of the reasons why we have you as one of our speakers at the Medical Freedom Northwest Conference in April, April 16th, or April 20th. Any healthcare professionals that are interested in going, we are having an event talking about opening up cash businesses, just like Brianne did. And because we want healthcare professionals to be liberated from insurance companies and be able to take direct care of patients rather than being dictated by an insurance company. So don't miss out on our conference, Medical Freedom Northwest in Spokane on April 20th. It's an all-day event.
Yeah. I really
So,
want patients to be educated on that too, that they have a
oh
choice.
yeah, and that's one of the reasons we're doing
Yeah.
this because we
Yeah.
want patients to be educated and empowered to take charge of their own health.
Yeah.
And
You
one
don't
of
have
those
to wait for insurance to tell you that it's pre-auth. You can
exactly.
do
And
it.
one of the things is that our education also includes finances, because patients need to take care of their own finances when it comes to when it comes to healthcare. And most
Mhm,
of them don't. They just wash their hands of it and say, "Oh, my employer pays for good insurance, whatever that is."
mhm,
And next thing you know, they don't realize that $2,000 a month is being taken out of their paycheck. Most things aren't covered. They have huge deductibles. There's surprises and non-transparency all the time. That's what we love about what you do. When you come to somebody and they say, and you tell them, when somebody comes to you and you tell them, well, it's going to be $160 for that service, it's $160.
correct.
There's no surprise bill 6 months later saying, hey, Dr. So-and-so had to read this thing and that's an extra $300, right? It's all
Correct.
inclusive.
It's all inclusive,
Right.
and you see where your money's going. It's going to that
Exactly.
machine and to me,
Exactly.
to my
So,
bills.
So tell me, what other places do you service? You just said you're going to move into Odessa. Obviously, you probably service Ephrata. Where else do you
I
go?
do. Dayton, Tonasket, Leavenworth. Those are Quincy. Those are the hospital contracts. And
Don't you have a
then
place
I do direct patient care clinics at Assurance,
in
or
Yakima?
sorry, direct primary care clinics.
Yeah.
Assurance Healthcare in Yakima, Home Health in Yakima. I'm going to Compass Direct in Ellensburg
Oh, I
today.
was just going to ask that. You might as well. It's on the way to Yakima, right?
Yeah, I do. I'm going there after this today, and Pacific Northwest Wellness Center in Wenatchee. So
Awesome.
far.
I love that. I absolutely love that. And you're expanding all the time, correct?
Yep, I'm trying. Yep, and I have my own little imaging center at my home. So anybody that has a doctor's order and wants to schedule with me, you can come to my little house and we'll do it.
So, how many miles do you put on a week usually, typically? Do you know those?
You would have to ask my
Numbers?
husband. I
Yeah,
try to sleep.
he does the driving. So
Dayton's a long day.
yeah, right. Dayton is a ways. So
Yeah.
tell us another story. Tell us a story where you really feel that you've impacted somebody's life by making it easier for them to get imaging, or a less expensive, and they were super grateful. Tell us a story.
Well, at one of the direct primary care clinics that I go to, um, we have this one little patient that I've had to see a couple different times. And instead of having to travel to Children's, she gets to be seen right there in her clinic in Yakima. And she doesn't have to go to Children's, and her mom gets a really affordable ultrasound every time. So that's
Yeah,
pretty great.
that's incredible.
Yeah.
What do you like the most about your job?
Oh, the patients.
Yeah.
The patients make my day. I love them.
What do you like about them?
Um, they just make me so happy. And even the ones that are a little bit grumpy, they're like an extra challenge for me that I try to make happy, and they always end up happy. So it
I
makes me,
love that.
yeah.
What a great attitude to have.
Mhm.
So, what is your favorite type of ultrasound to do?
I would say at this point, echocardiograms.
Is that kind of the most technical one that you do?
Yes.
And how long does an echocardiogram usually take?
Anywhere from 20 minutes to 45,
And that's
depending on the
basically
patient.
to see how their heart's working, correct?
Yes.
Yeah.
Hmm.
And who would typically order that?
Any provider.
Oh, really? So not just
Hmm.
cardiologists.
Nope, any
Right.
provider.
Yeah. And what is the turnaround time for after you do the imaging? What is the turnaround time for getting the read?
24 to 48 hours. There will be a report faxed back to your provider.
Is that the same in most hospital environments? Do they get the read back that fast?
They should, yes.
Okay. All right. So what is the future of rural imaging services? What would you like to see it
What I
become?
would like to see, I have a lot of friends ready for a change. And what I would like to see is eventually a free market imaging center where we could provide MRI and CT and X-ray and mammo, everything. But equipment is really expensive. So that's where I want it to go. But we'll see.
That's a great goal. And that's not something that couldn't be done. I mean, there are other states. There are places like that in other states. In Florida, there are cash imaging centers, and you can get an MRI for like $400 because
exactly. And I would love to provide that
because it's very, very competitive. And you know, as is true with most technology, I'm sure the prices of a lot of that equipment is coming down. You can chime in if I'm wrong. And I'm assuming some of that used equipment that is not the latest and greatest for some hospitals that doesn't have all the initials behind its name is still really, really good quality and probably on the used market, probably not worth a lot. So you can pick one up for a lot less expensive. Is that true?
I honestly have not looked in. I had a friend looking into MRI, but she was looking into mobile and it was $1 million. And I have not looked into CT yet. My friend's looking into mammo right now. And I have a friend looking into X-ray. So I don't know the numbers.
Yeah. I would imagine mammo and X-ray are quite a bit less expensive.
I think so.
Yeah. Yeah. Here's what I do know. I do know that free markets work and that eventually that is going to happen, that you're going to be able to, access an imaging center with all those services you just discussed for a very, very reasonable price and not have to go through a hospital system where an MRI is $4,000 to $5,000.
Yeah.
So tell us another patient story where you already told us about a kid. Tell us about another patient story where maybe somebody was really, really immobile or something and very hard to, a family member was taking care of them or they had a caretaker and they were very hard to get into into somewhere to move them, to get to an imaging center. Tell us about a story like that. I'm sure you've done a lot of patients like that where you've helped somebody.
You're putting me on the spot.
I am. You've got to have a story.
I've done a lot of patients. I'm trying to think of one within the last 6 months.
Yeah. Well, tell us any patient story where mobile imaging could have helped them. Where you saw them really have to struggle to get a patient into imaging services.
Well, I can tell you, okay, with my company already, Odessa called. They had an inpatient because they've never had ultrasound in Odessa.
Oh, wow. Interesting. Yeah.
Ever.
Yeah.
And so they called, I think it was mid-January, and just said, we have an inpatient that needs an echo. Okay. So we just drove over and I did an echo, and they would have had to transfer him somewhere, probably to Spokane somewhere for him to get that. So we just drove over on a Wednesday and did that. So that was nice.
Yeah. And that's just, I mean, you can't put a price on that. That is definitely priceless. So as we wind this podcast up, Brianne, what do you have a passion for?
My passion is just helping people. I've always been that person, and I never want to stop. I mean, that's just what I want to do. I'm a people pleaser, Shawn. That's a good
thing. You picked healthcare, right?
Yep. I guess that's all I can say. That's my passion. I want to help people, as many people as I can.
Good for you. It's obvious that you have a passion for this service. There's your website right there.
Yep.
It's obvious you have a passion for this service. It's obvious you love patients. You already said that. They make you happy. And I will say that, not everybody in healthcare can say that. So I really appreciate you for saying that. And it's inspiring because we got to remember why we went into healthcare in the first place. And it's to help the patient, correct?
Yeah.
Tell us a little bit about your website. There you are up there. Tell us a little bit about your website if people have any questions on how to get a hold of you.
So ruralimagingservices.org. On there you can email. I think there's like a reach out message me there that you are sorry. Oh my gosh. My phone number's there. You can also text. Texting is actually the best because if I'm with a patient, then I can text you back. I am sorry.
You don't have to apologize. You're doing great. You're doing great. So
my nerves are coming back out.
Yeah, I'm excited to have you, and I'm gonna share this. I'm excited to have you as a speaker at our Medical Freedom Northwest event. And there it is right there. It is April 20th. It's an all-day event. We start out early in the morning with breakfast, and then we've got speakers coming from all over the nation, actually. Scott Jensen, Dr. Scott Jensen is our keynote speaker, and he is going to be talking just about medical freedom in general and how to protect our licenses if we have to when we're speaking out for freedom of speech. You don't want to miss out, though. If you're a healthcare professional, definitely you don't want to miss out. We're going to talk about, we're going to have a nurse there. We're going to have Brianne there on imaging services, nurse there on how nurses can start cash type businesses, get out of the insurance model. I'm going to be talking about how pharmacists can do that. And we can use our knowledge and our skills to get out of the system and help patients. So you don't want to miss out. April 20th, all day event. Sign up. The room blocks are already full in the hotels.
And 7 CMEs.
Yes, that's right. 7 CMEs too. The room blocks are already full. We do have limited space, so don't miss out. Sign up as soon as possible. And Brianne, as we wind this up, how would you like to, what is a couple sentences how you would like to end this podcast?
I would like people to know that you can take control of your own medical care. And you don't have to, just because it's the only way that you've been taught, there are other ways. And it's okay to go in a different direction.
Yeah. Free yourself from the insurance model.
Yes.
It's not necessary. You are in charge as a patient. You are in charge of your own health. You just have to
ask questions.
Yeah, absolutely. And that's our job. Our job and our goal of this podcast is to educate and empower individuals to take charge of their own health.
Yep.
So you've definitely helped us realize that goal today. That Brianne, I'm excited to see you here in a couple months at our Medical Freedom Northwest conference. And I thank you for being on today and sharing your story.
All right. Thank you so much.
You're welcome. And listeners and viewers, thank you for tuning into Health Solutions with Shawn and Janet Needham. Tune into our regularly scheduled podcast, 12:30 to 1:30 Monday, Pacific Standard Time. Thank you so much.